Welcome to the Tools of the Trade live demo. Today, PartsSource PRO Service is the topic of the live demo, and it is eligible for 1 CE credit from the ACI. Presenter Jared Kozlowski, Vice President, Product Services with PartsSource, will guide us through the PartsSource PRO Service, the digitally powered solution transforming how hospitals manage equipment, service, and support. The PartsSource PRO Service platform brings your entire service program together in one place with one workflow and one trusted partner. During the demo, you will see how Pro Service gives healthcare organizations complete transparency into service cost, contract entitlements, and provider performance. You will learn how this data-driven approach, powered by real benchmarks and continuous vendor monitoring, helps HCM professionals make smarter decisions and ensure every service dollar is spent wisely. Jared will demonstrate the structured assessment process and show how health systems of all sizes are standardizing and simplifying their service programs. Thank you to today's sponsor, PartsSource. With the mission of ensuring healthcare is always on, PartsSource empowers owners and operators of mission-critical equipment to maximize clinical availability and patient throughput while achieving sustainable savings and efficiencies. PartsSource connects more than 5,000 hospitals and 15,000 clinical sites with more than 10,000 suppliers, enabling access to parts, service, and training through the leading technology platform for managing mission-critical healthcare equipment. The PartsSource Enterprise software platform, PartsSource Pro, enables 1,600 leading hospitals across the country to solve a shared set of challenges and maximize asset uptime, reduce cost, and increase procurement efficiency related to equipment maintenance. For more information, visit partsource.com. All right, real quick, it's trivia time. That's right, we're going to give away a multi-tool. The Super Bowl takes place on Sunday. Which city is hosting this year's Super Bowl? All right, well, everyone's putting their answers in using the chat feature. I want to remind everyone that there's downloads in the handout section that you can download. And TechNation is currently accepting nominations for 40 Under 40. So you can email me, jwallace@mdpublishing.com, your nomination, or you can search for the nomination form on the TechNation website. All right, stay tuned to find out who the winner is later in the webinar. I want to remind everyone that today's presentation is eligible for 1 CE credit from the ACI. 1 hour after the end of today's broadcast, you will receive an emailed survey. Completing that survey will grant access to a certificate that you can download and print. We will wrap up today's webinar with a Q&A. Please note that the webinar dashboard includes a questions feature, and you can submit questions for Jim at any time during the demo. Sorry, for Jared, anytime during the demo. Jared, you may begin whenever you are ready.
Awesome, thanks, John. I really appreciate it. Good afternoon, everybody, or good morning, or good evening, wherever you're dialed in from. So happy to be here. So my name is Jared Kozlowski. I'm VP of Product Management for PartsSource and for our service solutions within the portfolio. I've been with the company a couple years now, and have been in the HCM industry for my whole career in a variety of different roles. But really excited to be with PartsSource and helping to drive their mission of always keeping healthcare on. So to kind of calibrate everybody, I wanted to kind of walk through who PartsSource is and the service solution as a whole, and then really kind of connect that ultimately into the software demo at the end, so that you can see how everything comes together from a process, data, and capabilities perspective. So, but at PartsSource, as you heard us say, our mission is simple but powerful. It's ensuring that healthcare is always on. We do that by transforming how hospitals and health systems manage the performance and reliability of their clinical assets through enterprise-grade supply chain service, talent, and software solutions. We spent more than 20 years immersed in the reality of healthcare technology management, supporting some of the largest IDNs and most advanced HTM teams in the country. What started as a disruptive approach to parts procurement has evolved into a comprehensive tech-enabled platform that spans parts procurement workflows, service orchestration, asset visibility, training, vendor management, and real-time decision support is on its way. Today, we manage over 100,000 clinical assets from all major OEMs, have seen hundreds of thousands of service events with our national and supported those with our national multi-vendor network, and serve more than 15,000 clinical sites across the country. So let's take a closer look at what really sets the PartsSource platform apart in the market. Yes, we have a powerful software solution, deeply integrated with our customers' workflows and designed for frontline usability. But what makes it uniquely valuable is what sits underneath: an unmatched foundation of data, scale, and domain expertise purpose-built for healthcare technology management. Behind every feature and workflow is a system that has been shaped by over 2 decades of insight and operational scale. A few highlights. So we have over 3 billion benchmark data points that drive our precision procurement engine, more than 600 million in annual HTM's purchasing power, giving us the leverage to lower costs and drive vendor performance. We have 20 years of service and supplier performance data to drive decision support and contracting intelligence. Over 5 million SKUs in our catalog, curated and structured for HTM needs, not just e-commerce. Extensive cost of service benchmarks across modalities and device classes to support smarter vendor negotiations and service strategy planning. This is the intelligence backbone that makes the platform more than just transactional. It's what gives our customers clarity, confidence, and control, empowering and enabling in-house hybrid HTM programs to do their best every day. We also recognize that our users are under growing strain, tight budgets, shrinking teams, and increasingly complex technology landscapes. That's exactly what this platform is built to address, enabling organizations to do more with less while turning service delivery and asset management into a source of operational leverage. And now we're extending that platform vision with Pro Service, our response to one of the most entrenched challenges in the HTM space: fragmented, difficult to manage outside service needs and contracts that hide costs and drive inconsistency. We'll go deeper into that today, but this is the foundation. A platform built not just to transact, but to orchestrate, optimize, and elevate the way healthcare manages clinical assets. So this wheel, as we call it, represents how we holistically think about our solutions at PartsSource. So yeah, we do more than just parts. It's not, and these aren't just a set of products, but as a single integrated platform designed to manage mission-critical clinical assets across their full life cycle with purpose-built solutions. At the center is the PartsSource platform, a single enterprise-grade system that connects parts, service, asset, and talent through shared data, workflows, and intelligence. And everything on this wheel is intentionally designed to work together. That integration is what allows us to move from transactional support to predictable high-performance outcomes. As you move around the wheel, you see the breadth of our capabilities now: parts procurement, service delivery, asset visibility, device telemetry, uptime management, training, decision support coming. Individually, each of these capabilities solves a real problem. Collectively, they create something much more powerful: a connected ecosystem that learns, benchmarks, and improves over time the more you use it. And our Pro solutions aren't a standalone program or just for parts anymore. They are a natural activation of this platform for organizations and enterprises looking to optimize and scale their HTM programs. They are differentiated in the market by a single enterprise platform, deeply integrated with CMMS and ERP systems to standardize procurement and service workflows, saving your team's time. Our evidence-based procurement engine, powered by more than 3 billion benchmark data points, measuring vendor quality and performance. Formulary management, enabling enterprise-wide purchasing and service strategy preferences that improve compliance, cost control, and quality. Industry benchmarked service and cost data, helping customers uncover savings opportunities and build the case for smarter insourcing decisions. And then negotiated volume discounts, transparent pricing, and performance SLAs through our community buying power. And that's across more than 6,000 OEMs and vendors, and that buying power grows as the community grows. So PartsSource Pro solutions simplify workflows, standardize decision-making, and bring confidence back into procurement by embedding intelligence directly into how work gets done. This is how we move from managing transactions to orchestrating outcomes, and why PartsSource Pro solutions represent a critical next chapter in how PartsSource ensures healthcare is always on.
Right, so we're going to launch our first poll real quick. And The question is, which challenge best describes your organization's current service contract environment? Select one of the following. Too many fragmented contracts with limited visibility, rising service costs, little ability to benchmark performance, lack of internal bandwidth to manage contracts strategically, difficulty transitioning services in-house with confidence, and we already have an optimized data-driven service strategy. We have some answers coming in. And the results are in. The top answer with 35% was we already have an optimized data-driven service strategy. And right behind 35% answer was 29%, too many fragmented contracts with limited visibility. So those were the top two answers. And then third was difficulty transitioning services in-house with confidence.
And those responses line up with actually my webcam switched.
For high tech.
There we go. That's a better view.
Let's switch back.
You know what? I'll just go dark for a minute. We'll keep going, and I'll come back. So that survey did a pretty good job of uncovering what we have seen in the market, and we actually before, as we started to get into service, we went out and we did a study. Because we are very data driven and evidence based, and so what we did here though wasn't like a one-off survey. This was a longitudinal look across hundreds of service contracts across a statistically significant number of customers, and the takeaway was pretty simple. The system is fundamentally inefficient, and it's a real challenge to effectively take control of your outside service and start to shift and optimize that outside service with how you want to bring it in-house. First, there is cost pressure without control. On average, upwards of half of or more of many of our organizations their spend is locked in service contracts. Yet we saw up to 60% cost variance for the same assets with the same coverage across different sites. That's not a strategy, but that's noise and waste because of lack of visibility. Most customers were managing well over 100 individual contracts or devices, which makes discrete optimization nearly impossible. Second was bandwidth and both administrative and technician being a real bottleneck for teams. It takes 3 to 4 months to negotiate a single contract, and 75% of contracts are lower dollar, meaning our customers were burning scarce time on work that doesn't really move the needle. They are stuck managing friction, not improving uptime, cost, or operational performance and throughput. Then there are the countless hours and days managing vendors across the health ecosystem, sapping impactful hands-on device time and floor time for your teams. The third data exists, but it's really disparate and it's hard to drive insights, and it's not normalized. Nearly every customer we studied or that we talked to today lacks a standardized data-driven way to connect service decisions and management to organizational risk, cost, or quality. Contracts aren't benchmarked, vendor performance isn't measured consistently, and decisions are largely reactive. It's a definition of fragmentation and sprawl. And so that was how we started to move into service. So we built Pro Service, and it's a portfolio of enterprise-grade, digitally powered solutions designed to transform how organizations manage equipment service end to end. When you strip it down, service is actually pretty straightforward. What you need is parts plus people with skills. You need to figure out where it's done. Is it on-site, depot, or can you solve it with tech support? And then how you manage the financial risk, in-house, contracted, time and materials, or a mix of those. So service is service is service. What makes it complex and costly is that fragmentation we've spoken about. Our service solutions are powered by real-world benchmarks, structured service assessments, defined coverage strategies, and continuous vendor performance monitoring. That combination enables our in-house teams and customers to optimize coverage, improve reliability, and ensure service dollars are working harder across the enterprise. The results are meaningful and measurable. Customers achieve upfront savings to reinvest in their teams. reclaim time for internal teams, faster, more consistent measurable service outcomes, and improved accountability across their service programs. In short, we help organizations simplify service operations while transparently strengthening performance, control, and confidence. Our approach to unify the service ecosystem into a single operating model. That means one digital platform, one standardized set of workflows, one industry-leading vetted vendor network, one source of truth, and one accountable partner. What we're fundamentally doing is changing how service is managed. For customers juggling numerous service contracts, countless time and materials events, and fragmented vendor relationships, while struggling to gain normalized visibility into service performance and cost, the PartsSource platform and Pro Service brings clarity, control, and streamlined execution. We standardize service event intake and execution through our evidence-based precision procurement engine. We take what used to be hundreds of one-off decisions and turn them into repeatable, governed service motions. We enforce enterprise-level vendor strategy. Our formulary-based service strategy planning and management isn't about limiting choice. It's about making choice intentional and upfront. We bring visibility and truth through peer benchmarks and service analytics, give customers something they've never had before, a clear external point of reference for cost, performance, and coverage. And then we turn scale into cost and performance advantage. Once service is visible, standardized, and governed, customers fully unlock community-based purchasing power. Instead of managing service through disconnected contracts, vendors, and processes, customers manage it through one integrated system. This unified model gives customers complete transparency into service costs, contract entitlements and coverage, vendor performance, and operational outcomes. And that transparency is what allows organizations to move from reactive service to proactive data-driven orchestration. The bottom line is we've got end-to-end service management here. We manage the event, the vendor, the cost, the quality, the data, end-to-end. That's how cost efficiency improves without sacrificing quality or uptime, not through price pressure alone, but through smarter aggregation. Now let's double click into some of the core features within the Pro Service solution. Everything we do in Pro Service starts here with a shared understanding of how service actually works in your environment today. Our first step is a collaborative assessment of your current service strategy and workflows. We do this shoulder to shoulder with you and your team without disrupting day-to-day operations, so recommendations are grounded in your operational reality, not assumptions. We start by bringing together the inputs you already have: CMMS data, contract documentation, vendor information, technician capacity, and training readiness, to complete a picture of how service is being delivered today. This is what you see on the left-hand side of the slide, the data we ingest, not new work we impose. From there, we look holistically at how service is delivered across the sites, technician workflows and response times, parts procurement and documentation practices, compliance and operational visibility, and technician training and capacity. This isn't about grading performance, it's about understanding where complexity, variability, and hidden costs are entering the system. We then layer in peer benchmarks and analytics powered by over 35 million proprietary data points across service cost, coverage, vendor performance, and outcomes. The output is not just insight, it's direction. You receive a clear, practical roadmap that identifies where vendor consolidation makes sense, when to rebalance in-house versus external service, and how to optimize coverage and spend over time. Those recommendations may support an immediate transition, a phased roadmap, or a validation of existing strategy based entirely on what the data supports. Once live, this doesn't disappear into a report. Your analytics dashboard keeps service performance transparent, supporting both short-term operational decisions and long-term capital planning. The result is higher first-time fix rates, reduced downtime, stronger compliance, and a service strategy your team believes in because they helped build it and they own it. Once service strategy is defined, the next critical capability is making sure that the right vendors are consistently delivering against that strategy. At the outset of the engagement, we work collaboratively with customers to design a vendor strategy that aligns to their clinical operations, risk tolerance, and cost objectives. That includes identifying and pre-selecting preferred vendors, OEMs, ISOs, in-house talent, or a blended model. So vendor choice is intentional, governed, and aligned from day one. This is not about limiting options, it's about setting clear expectations up front. Once established, Pro Service consolidates service coverage across multiple vendors into a single, centrally managed operating model and agreement with us as a single accountable partner. Instead of managing dozens of vendor relationships independently, customers gain one system with full visibility into performance, responsiveness, and accountability. And behind that model is our national network of over 5,000 certified pre-review technicians and vendors, ensuring that most qualified, geographically appropriate resources dispatched for every service event. What truly differentiates this capability is how vendor performance is measured and managed. Every technician vendor is continuously evaluated using real-time service activity monitoring, benchmark performance and cost data, quality assurance and compliance scoring, peer reviews, and post-event customer feedback. This creates transparency, accountability, and continuous improvement, not just at renewal time, but during every service interaction. All this data feeds directly into our proprietary precision procurement engine, so vendor selection, routing, and price decisions are always grounded in evidence, not anecdote. That's how customers move from reactive vendor management to proactive service optimization and gain confidence that every service event is being handled by the right resource at the right cost with performance they can measure and manage. The last big piece is standardized workflows in our evidence-based procurement engine. Once we've established the baseline, your current service performance, coverage levels and contracts, and aligned on a roadmap, the next step is operationalizing the strategy into day-to-day execution. Every service request, regardless of how it enters the system, flows through a single standardized path that eliminates coordination, reduces variability, and gives customers real-time visibility into every service event. From a user perspective, it's simple. When a device has a problem, your team can submit a request, however it's most convenient in the moment, email, phone, the online portal, or through a CMMS integration. From that instant, the service event is live. A PartsSource Service Solution Specialist confirms the asset, checks coverages, and your approved service strategy formulary is applied. That may mean dispatching a preferred vendor or an optimized alternative based on evidence, availability, cost, and performance history. From there, everything is tracked in real time. Status moves clearly from receive to dispatch to on-site to complete, all time stamped, visible, and auditable. Across sites and teams, everyone sees the same live view. No chasing updates, no disconnected systems. When the service event is complete, field service reports and documentation are automatically archived and searchable, making audits, compliance, and historical analysis straightforward. Standardized workflows free engineers to focus on higher value work, while leadership retains transparent end-to-end visibility into activity, cost, and vendor performance all in one place. This is how we turn best practice into operating practice, not by adding processes, but by embedding intelligence, consistency, and accountability into every service event. All right, so now we will get to the live demo portion of the show. So bear with me while I switch screens here. Good. So hopefully everybody has seen has been a PartsSource before and has seen it. But so again, if you've been with us, you know us. But I'll orient you to our software platform, and then take you through some of the features and capabilities of both the platform and Pro Service. So here I'm on our landing page, homepage of the catalog. At the top, you've got some very basic measures and status updates widgets at the top, just to let you know what's kind of going on when you come in. But this is where you can search for parts, and we'll come back here in a little bit when I show you how we support say an in-house labor but PartsSource Pro Service contracted device. On the left-hand side, you've got all of our features and capabilities in a single place. So any of your shopping lists, command center, one of our newer SaaS solutions, asset uptime, visual analytics, our parts center, and the service center. Within the service center, everything's aggregated, and you can request on-site service, coordinate depots, look at your on-site service requests, check out your depot repairs, and then submit work orders again for one of our Pro Service coverages called in-house labor and support. So first, I will land on our command center. The command center is our top-down look at everything that's going on or across the organization, along with last statuses when things have been delivered. If there's an FSR available, you kind of have a constant feed of what's going on. You can see the most critical things that you need to follow up on top. You've got, you've got visibility to exchanges, returns, approvals from a parts perspective, and then down in the operational activity here, you can see your different repair scenarios that are going on. You've got depot repairs, you've got loaners, you've got on-site service requests, and you can track those over time and also get detail into what's going on with them just by simply clicking the widget, and you'll get a list of your active records that you can dig into and click on and manage if you need to. We also have our visual analytics, which is our deep dive into performance monitoring, benchmarking across all of our different solutions. We have an initial tile for kind of each dimension of a program that we want to be able to dig into, and I'll dive into the repair and service agreements here in a little bit as I go a little bit further. And then, like I said, over here, you can simply click buttons. You can just click request service to search for a device. And I can just go through here. I would like service probably Thursday to Friday. It is critical hard down that I need it. And so that I continue, I can put in my contact information and I hit request. So that request will go in, goes immediately to our service solution specialists, and they begin coordinating service for that device based on, again, your coverage levels and service strategy formulary. And you can watch that request move through from initiated to awaiting approval or open service events, depending on what that level of coverage is. Once work is completed, you can see here we will publish an FSR that can be downloaded and for your both review and for inclusion in any other compliance systems that you may have from a CMMS perspective. The same process really kind of works for Depot as well. But again, that's one workflow, one way of requesting service, and a way of consolidating service into a single outside service needs into a single platform, which then normalizes everything. The value of that normalization really comes through our visual analytics. And so as you get a single intake and then a single vendor network that's all measured and managed the same way, you can start to normalize and view your service strategy outcomes in a single place in a single way. And so our program performance dashboard here allows you to see over on the left-hand side, service performance or service events summaries. You can look at the number of events, critical repairs, preventative maintenance, completion times, key measures that really demonstrate what has been happening within your service program and your contracted devices. We also measure critical event resolution time. As we know, like again, keeping healthcare always on, and mission critical devices need to get back into service as quickly as possible. At the top, you'll see spend versus service budget, and this is where that cost control and transparency really comes in. So as you bring devices under the Pro Service Agreement and contract them, and the coverage levels again are associated with a service budget or a cost, and you're able to manage that. And one of the most powerful coverages that we have is our fully capitated full service with shareback. And that really allows you to manage cost with a capitated amount, but then any savings that you drive by using independent service organizations or in-house labor is able to be, a portion of that is able to be returned to you at the end of the year, allowing you to reinvest that money into your teams through training and other improvements. But that's that service, that spend versus service budget there at the top. You can see you'll have a complete breakdown of all of your assets that are covered here at the top as well. And then you start to get into trends over time. So you have your actual expenses that have occurred by quarter. We break them down by service type, as well as from a cost perspective, as well as from account perspective. And you can start to drill into what's really driving portions of these trends over time. So as you click on them, it begins to filter and allows you to look at what the breakdown is, whether both from a vendor usage perspective as well as from a modality perspective and a manufacturer perspective. And then let's unfilter that. And then the service events are going to broken down by type, and then spend over time and events over time can also be looked at the strategy that's being employed within the pro service agreement. So breakdown between OEM, independent service organizations or ISO, and then that in-house component. We know and have seen over time that the most cost-effective and way to ensure device uptime for mission-critical devices is trained on-site in-house teams and resources. And so the pro service program and our shareback coverage allows customers to bring in full service agreements, bring in those devices, ensure that they're capitated from a risk perspective, but then to get training for their teams, for their technicians, and to start to bring that or phase that work in-house, allowing you to shift costs and reduce costs over time. And as you reduce costs, you then increase your budget for training and for expanding your team, giving you additional leverage to grow and mature your program over time. And so that's really the flywheel that we try to employ with our pro service solution. And so that's why we have that breakdown here and really trying to drive up in-house support over OEMs and ISOs. We also show OEMs versus ISOs because in our experience, we can get equal or better service from an independent service organization over the OEM in a lot of cases. And we've got our data benchmarks to show that over time. So then at the bottom here, we also have top assets with multiple events that allows you to really drill into problematic devices and those things that could really that you could either potentially prune from your inventory, replace. Maybe there's additional training. Maybe it's a problematic vendor, but you can really dig into that. We also break down top manufacturers at the bottom. So from a device perspective, we can also look at location. We can also look at model. And how those change over time. And then on the right-hand side, we have our service mix by vendor and modality. So you can look at OEM service, you can look at ISO service, and how those are driving your different modalities. And you can then begin to look at how different modalities are driving your costs. And where here you've got an X-ray unit. X-ray units are 39% of your costs. Heavy number of those are General Electric, and then when we look at the cost up here, we're doing a decent job of bringing those solutions. We're starting to bring those solutions in house, but a heavy amount of the cost is driven by OEM and ISOs, and so there's an opportunity to get training there. And so you can start to look at your training budget. You can start to look at the training resources available through our talent side of our portfolio and our STI. And you can bring those. You can look to bring that service in-house to reduce your costs even further. And so that's visual analytics. And like I said, our other solutions have very similar benchmarks, benchmarking capabilities, analytics capabilities that all reside in the platform again in a normalized, very scalable way. All right. So that is actually, you know what? We'll do one last thing too. So we go back to, say we have an in-house supported device. And so I've got a technician who's repairing our hologic mammography equipment. We need to buy a part for the device. Let's see if I can type and select at the same time. Let's say we need a face shield assembly. I'm going to go ahead and add that to the cart. I'm going to check to see if this device, I'm going to add my device to this, and it's this hologic X-ray unit here. What is going on? Under contract. Oh, wait, yes. Add to cart. Added at the cart, they validated that the part was under contract. and I'll go through, and then I will go through and just go ahead and ship that part. Oh, we've got a lot of cards in here. You know what? Let's just process this order. We'll ship that. We'll go ahead and order that part now because that device was under contract. We are. It will go ahead and go place that order against the contract, and that part will be covered, and it will simply just ship and arrive in your facility. You'll be able to track that part like you would any other part through the PartsSource platform, which is again, it's that the power of that singular platform and service coverage. So I will bounce back here. What are we at? 235. You know what? I'm going to do something else too for the group. So we've been working on a new user experience for our pro customers, and one of the things that we heard. So this is a different environment. This is actually a development environment. So this is a kind of a preview of stuff that's to come. One of the things that we heard from our customers is they're just creating better ways to find all of the actionable events and things going on within our platform, being able to get to labels, to do approvals. And the other component is when integrated with CMMSs, we would like users would like to be able to find parts and services more efficiently because we know what their devices are. And so one of the things that we've been working on is this personalized experience from we call it it's my dashboard. But it's an asset-centric capability within the platform. And so as we have your devices, your CMMS integration, we're able to show you the devices in your inventory. We're able to then search against parts for those. We're able to search against service, and we're also able to put all of the most important information right up front for you. And this interface is actually is a leap forward for the platform. And it's highly customizable. And so we're able to collapse, we're able to reorder how the dashboard works, and put that personalize it and save it, which is a really powerful way to be able to manage your day-to-day within the platform as you work across against parts, service, asset, and talent. We've got all of our different widgets on here. So you've got your full service events history, parts events that are going on. You have your service events all in one place. You can quickly get to open, work completed. You can see what's going on with an initiated but hasn't been dispatched yet. And then from a parts perspective, you can see your in-progress orders, your exchanges, and your returns all in one place. Able to print labels. If there's an approval that needs to be nudged, is what we've come to call it. We can actually do that. Nudge it, push it, and then ensure that person is getting that approval done. If you've got quotes available, you can quickly get to and continue checkout. And then within the asset inventory, you're able to see some basic asset information, and we'll request service against that device, and you'll be able to see the purchases against that device over time as that happens. And so, like I said, this is this is a demo or new software. It's in alpha right now with a few customers. But then again, a really cool way for us to help our customers manage their devices and all of their procurement in one place. The other really interesting thing here is that we can actually create customized lists of devices, and we can link a device to a list specifically, so that we always have that list of either its parts, PM kits, whether repair items, tooling. All of those things can exist in a different list along the side with this capability. So again, really neat new software solution coming to our pro customers here in the near future. But kind of wanted to share that for the group on the phone. So with that, I will switch back over to presentation. Oops, that's not valid.
Jared, are you still with us?
There I am.
There you
Had to switch it back. I apologize for going silent. Can't do two things at one time. All right. So with that, I will kick it over to John from a questions perspective. If anybody has any questions, we'd like to get in contact with us about Pro Service, doing a service assessment. There's a QR code on the screen, and it'll take you to our website, and you can put in your contact information, and we'll reach out to you and set up a discussion.
Fantastic. We did have some questions come in. If anybody else has other questions they want to submit using that questions feature on your dashboard, you can do so at this time. One question we had come in, Jared, is how does Pro Service determine which contract should be consolidated first, and how quickly can we expect to see savings?
So when you go through the service assessment process, the team will take a look at all of the contracts. They'll look at expiration dates. They'll work with you to understand your team's capabilities, training pathways, multiple different variables that kind of go into that. But if those contracts are either cancelable or coming up the term, those things can be moved over into the Pro Service program and then enabled, whether again through vendor support, OEM, ISO, or again that in-house training capability is really powerful, or a blend thereof. That transition can happen fairly quickly. So it really comes down to the contract and your desire to move.
Okay, this sounds like a really good question. How do you evaluate vendor performance beyond price?
Yeah, that's a great question. So vendor performance first the strategy goes in. There's a strategic relation that's put in place with our vendors, and that's again because of the size and scale that we're operating at. We're able to look at those vendors. We'll look at the geographic location of our customers, their devices, and so we put a relationship in place that's mutually beneficial with the vendor, leveraging our scale. And that includes SLAs, it includes performance requirements, it includes certain staffing requirements, response times, things of that nature. And so that's the first thing that kind of goes into place. And then after that's in place, and that vendor is being activated at our customers' sites, we're monitoring those. We monitor on-site response, we monitor acceptance of the call, on-site response time, first-time fix rates. We monitor return calls. We monitor customer satisfaction. So we follow up after that service call to see how that vendor did. And so all of those metrics, in addition to cost, go into monitoring the performance of that vendor and ensuring that they're delivering on their promises and with all their capabilities.
Fantastic. Another question we had is, if 75% of our contracts are low dollar, how does Pro Service reduce administrative burden without increasing clinical risk?
So those contracts can be basically consolidated down into a Pro Service agreement. So you have one contract, and that may have multiple vendors, but we're managing those multiple vendors for you. So really, the simplicity is it's one contract, one partner, one place to call, even though you have multiple different devices and potentially multiple service strategies that you want to employ for those devices. And so you've got to, you do have to. That's what makes it simple. Is it's that one single agreement, and that allows you to streamline your operations.
Gotcha. I think that's all the questions we have right now. So I'll go ahead and close us out. Thank you so much for sharing your knowledge with TechNation today, Jared. That was a great presentation. I really appreciate it. I anticipate a lot of people are probably scanning that QR code right now to get more information. The winner of today's multi-tool for correctly answering the trivia question is Brian Simpson in California. The correct answer is Santa Clara, California. That's where the Super Bowl is going to be played. So out in sunny California. Now, a quick reminder that you can obtain your CE certificate by completing the post-webinar survey. The survey will be emailed in 1 hour. You must complete the survey to receive your 1 CE credit from the ACI. and you will be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us through email at webinar@mdpublishing.com. Thank you for your attention today and have a great day.